Spina bifida. Have you ever heard of it? It occurs when the spine of a baby doesn't close in the first month of pregnancy. It's one of the worst congenital birth defects imaginable. In severe cases, a sac-like portion of tissue protrudes from the newborn spine, and in this sac-like protrusion is the baby's cerebrospinal fluid, nerve roots, and the baby's spinal cord. According to the Centers for Disease Control and Prevention, spina bifida is the most common permanently disabling birth defect in the United States. And yet, according to the Spina Bifida Association, it's also one of the most preventable birth defects. As a nurse, I've treated children with this condition, and it's heartbreaking to know that so many children suffer from it when it's so easily preventable. Today, I would like to inform you how women can prevent spina bifida with good prenatal nutrition. Let's start by discussing the effects of spina bifida. According to James Atwell, in their textbook, Nursing Care of Children, severe cases of spina bifida result in paralysis, partial paralysis, various sensory deficits, club foot, and dislocated hips in the affected babies. And this is only the beginning. As the child with spina bifida ages, he or she can expect to suffer from latex allergies, hydrocephalus, depression, urinary incontinence, obesity, and skin breakdown. As you can see, spina bifida is not just one condition. It results in many problems that affect the body, the mind, and the spirit. Now that we've seen the effects of spina bifida on a child, let's look at how we can prevent this terrible birth defect. According to the Spina Bifida Association, if all women who could become pregnant were to take a multivitamin with B vitamin folic acid, the risk of spina bifida could be reduced by 70%. So folic acid is a very, very important nutrient. But what is it? As I've said, it's a B vitamin, and it helps build healthy nerve cells. But because it's water soluble, it doesn't stay in the body for very long. So women need to take it every day to prevent spina bifida. In addition to vitamins, we can also get folic acid in the foods that we eat. According to the U.S. Department of Agriculture, their nutrient database tells us that exceptionally good sources of folic acid include cooked chicken liver, wheat bran flakes, all bran cereal, and product 19. It's a breakfast cereal. But if you can't stomach the thought of eating chicken liver, other good sources are legumes, leafy green vegetables, and orange juice. So now that we know how easy it is to prevent spina bifida with a simple vitamin supplement, why is it that spina bifida is so prevalent? Probably the main reason is because approximately 50% of all pregnancies are unplanned. According to the National Campaign to Prevent Teen and Unplanned Pregnancies, 1 in 2 pregnancies, about 3 million per year, are unplanned. When a woman plans to get pregnant, she normally visits the doctor to start her prenatal care, and he'll prescribe or she'll prescribe a multivitamin, prenatal vitamin, which includes folic acid. But if a pregnancy is unplanned, a woman may not even know that she's pregnant until a folic acid deficit has already damaged her developing baby. That's why it's so important that all women who could become pregnant should take at least 400 micrograms of folic acid every day. 400 micrograms? Now that may sound like a lot, but according to the authors of the book Nutrition, taking a simple multivitamin every day can meet that requirement and reduce the incidence of spina bifida by 70%. That is huge. If you didn't know about spina bifida before today, you know more about the effects of this terrible birth defect now, and how women with good prenatal nutrition can prevent it. If you find that eating a nutritious meal every day is as elusive for you as it is for me, don't worry. You can still do your part in reducing the incidence of this terrible birth defect by simply taking a good multivitamin every day. Whether you're planning to get pregnant or not, I urge you to do it. In fact, go out and get some vitamins now if you don't have them. And that's what I'm going to do for my wife right now.